Well, this is not good. Poison control centers across the country say they are seeing a 1,500% increase in calls related to medication use for diabetes and weight loss drugs, with some people reporting symptoms related to accidental overdoses using these medications, including Ozempic and Wegovy. Here to talk more about it, Dr. Chris Pernell, public health physician and regent at large for the American College of Preventive Medicine. Dr. Pernell, thank you. So accidental overdoses, what exactly is happening here with these medications?
Hi, Marni. So this is concerning news. What we know today is that there has been a severe uptick in calls into poison control centers related to persons either receiving too much of the medication or not sure if they doubled up on the medication. And so we're seeing people having things like nausea and vomiting and severe stomach pain. We think it may be related to the fact that there are, if you will, copycat versions of Ozempic and related forms of semaglutide on the market, whether those are the result of compounding or things that you're finding in these medical spas and of the sorts.
Yeah, so where are people getting these knockoff drugs? I mean, are they pretty accessible and are they cheaper? Is that why people are using them?
Unfortunately, yes, they are cheaper. What we have happening is that when these medications that are legitimate, worthwhile tools to help with diabetes control and weight management are out of the price range of most Americans, then you see either people resorting to compounding of these medications, right? Because that's using sometimes similar but not the same ingredients that have been patented, or you find these cheaper versions of these medications because people want the desired effects. And we see both a shortage because of that rash on prescribing of Ozempic and similar medications, or because of the high costs.
Is the jury still out on these medications? I mean, do we know the long-term health risks and what happens when people go off of them?
So long-term is actually something that's being defined every day. We're having an accumulation of data, an accumulation of evidence of both the safety, the efficacy, and the long-term benefit. What we do know today is that these medications do work. I think there's been, unfortunately, a demonization and a stigma around those who do utilize the medications, who need them to either, like I said, achieve diabetes control or weight management. For too long, we had limited tools in our toolkit when it came to fighting overweight and obesity. What we need is better public and patient education around the appropriate uses of the medication. We need to ensure also that providers are aware of who qualifies or who's eligible to receive them. And then we need to make sure that these medications are appropriately priced and are safe in their administration.
There's also some promising medical news on morning sickness, some new research. What is this showing us about morning sickness and some possible triggers and treatments?
Yeah, so this is quite interesting and very welcome news. In the first trimester of pregnancy, women or birthing people may have hyperemesis, which is very severe nausea and vomiting. This can lead to hospitalization and a host of other complications. What researchers are finding is that there is a particular hormone, a stress hormone, if you will, that is secreted or released by multiple different types of cells and tissue in the body that can be released in response to infection as one of the stressors. And this is at a higher rate when a person is pregnant. Those hormones are have uptake in the brain in particular, in an area of the brain that is responsible for controlling nausea and vomiting and things of that nature. So if we're able to target that particular hormone, or by targeting those receptors, hopefully we can see persons suffering from hyperemesis or excessive vomiting during pregnancy having considerable relief.
Yeah, which is a lot of women, right? 2/3 of women experience nausea and vomiting in that first trimester. So we'll continue to watch this. Yeah, it's debilitating. Dr. Chris Pernell, as always, appreciate your time on these important topics. Thank you.
Thank you.
We are learning